Okay, so this section I'll talk about health, a couple reminders, and at the end I'm going to talk about the protocols we're using at school to send your child home. So make sure you stand for that little update. So this is that famous health screener. It's on our website. It's been sent out in numerous highlights this year. This is what we're asking you to run through every morning before you send your child to school. So ask your child the questions in part 1. If yes is the answer to any of the ones in part 1, they should not come to school, and you would be calling your pediatrician for next steps. And then part 2, ask your child, do you have a sore throat? Do you feel super tired? Are you sick to your stomach? And if there's an answer to 2 of these or more, then same protocol. They shouldn't be coming to school, and you'd want to call your healthcare provider. I would suggest, if you haven't already, print this out, have it on your fridge, have your thermometer out every morning just to get in the habit of running through these questions and then taking that temperature as well. So here's a little picture of the Fife household. Here's our morning. We do cereal bowls, juice glasses, cereals out, and we just have our thermometer sitting there, and we just zap our kids in the morning with it to make sure that portion of this questionnaire is done, and then just some conversations with our kids about that. So great protocol to make sure if we all do those things, then we know we're sending our kids to school healthy. Not only is this a COVID safety piece, but as we're entering this flu season, cold season that's starting, it's just a good practice to have those questions asked of your children. One thing I want to share with you as well is sending kids home. So as I just said, we're starting that cold season, we're starting that flu season, and as you can see from the symptom checker, a lot of those symptoms on part 2 are also symptoms of just a common cold. So we, in the COVID pandemic, we have to follow what's being advised of us from the health department. If your child comes to school and some portion during the day they go up to their teacher and they say, I don't feel good, the teacher is going to just say casually, what's not feeling good? If they report 2 of those bottom symptoms, then we have to send the child home. So our protocol is the teacher then would call up to the office would come down and retrieve that child. They need to go to our isolation room. One of the admin team will take their temperature, and then we record down the data. So we record their temperature, and we'll record down what symptoms they reported to us. You get a phone call, and we let you know that one of your children are displaying signs of COVID. You need to come pick up your child. If there's siblings in the school, then the siblings are also sent home. At that point, you have a decision to make as a parent. You can either get them tested for COVID, or you can not get them tested for COVID. If you get the testing for COVID for that symptomatic child, your child and the siblings need to stay home until the test results come back. When the results come back, if it's negative, everyone can come back to school literally the moment you get that test back. We need to get a phone call. You need to verify the negative. You need to show us that negative result, and then they can come back literally the moment. Happened this week. We got results back. I think it was 12:30. Parent called, talked to the parent and said, bring your child to school. And that kid was here within, I think, 15 minutes. So that's that protocol. If the result would come back positive, then we follow that positive COVID kind of flow chart. So this child that's positive is isolated for 10 days from when those symptoms started. Any siblings have to stay home for 14 days from the last contact with that symptomatic child. So again, I'm going to walk through this one more time. If you can't isolate your kids, and if they're together, then the non-COVID children have to stay out of school for 14 days from last contact with the symptomatic child. So this child has COVID, they're out for 10 days. Your other kids are interacting with that child for the 10 days. After the 10 days are up, this kid can come back to school. These guys got to stay home now for 14 days because they had contact up until that 10th day. If you can get your child to isolate so there's no contact between your other children, then these guys can come back 14 days after that last encounter. If you choose to not test your child, or let's say your child's afraid and doesn't want the test and you're thinking we're just not going to go down that road, then the symptomatic child is isolating for 10 days, siblings 14, the same scenario I literally just walked through. And the reason is we have to assume that the child has COVID. So runny nose and cough, we're assuming that's COVID. That's the directives from the health department on that. So it's worth your while to really try to get testing. The health department wants people to be tested if at all possible. When we call you to pick your child up, we will give you that sheet of the symptoms and what their temperature was. And we will also give you directions or some testing sites that you can go get your child tested for that test. Any questions, let us know. We've now walked through, as a school, we've been through, I think, almost every scenario that could possibly be out there. So we're kind of becoming a little bit more experts at what to do and being able to answer questions rather quickly. So give us a call if you have a question. I know it's frustrating at times when your kid's coming home and you're like, it's just a cold, but do know that we have to take those measures to, again, mitigate the risk, mitigate the potential spread if it would possibly be COVID.